Common vitamins and supplements that cause liver and kidney damage. Have you ever wondered what could happen to your body when you consume too many vitamins and minerals? Could supplements that promise to improve your health actually be putting your kidneys and liver at risk? And most importantly, what tests should you do to identify possible damage before it's too late? Taking supplements is an increasingly common practice among people looking to improve their health and well-being. They are present in pharmacies, gyms, and even supermarkets, being advertised as quick solutions to various problems. But are all these products as safe as they seem? What many do not know is that when consuming supplements indiscriminately, they may be ingesting substances in doses that exceed the body's needs. This puts a strain on vital organs such as the liver and kidneys, which play an essential role in filtering and metabolizing these substances. Today, we're revealing the 9 most popular supplements that can cause serious harm to your health, plus 4 dangerous ingredients often found in these products. Understanding the hidden risks behind this practice is the first step to making more informed decisions and taking better care of your health. Let's get started. 1. Vitamin D. The vitamin from the sun that can become a trap for the kidneys. Vitamin D is essential for the human body. It helps with the absorption of calcium and phosphorus, promoting bone health and helping the immune system function. The body produces it naturally when exposed to sunlight, but many people turn to supplements to make up for the lack of this vitamin. The problem arises when there is excessive consumption of vitamin D supplements. Doses higher than necessary can lead to a condition called hypercalcemia, that is, high levels of calcium in the blood. This situation forces the kidneys to work harder to filter excess, which can cause long-term damage. Over time, this excess calcium can accumulate in the kidneys, forming stones or even leading to kidney failure. Furthermore, prolonged and indiscriminate use of vitamin D supplements can also result in symptoms such as nausea, vomiting, muscle pain, and weakness. Many people don't realize that, with just 15 minutes of sun exposure a day, it is possible to achieve adequate levels of vitamin D without the need for supplementation. However, factors such as using sunscreen, living in regions with little sunlight, or working indoors can make it difficult to synthesize this vitamin. Therefore, the use of supplements should always be guided by a doctor. A simple blood test can determine vitamin D levels in the body and indicate whether replacement is necessary. Avoiding indiscriminate use is crucial to protect your kidneys and prevent serious complications. Vitamin D, when used correctly, is a powerful ally for health, but when consumed without control, it can be a dangerous trap for the functioning of your vital organs. 2. Multivitamins and multiminerals. The silent pump for the liver. Multivitamins and multiminerals are, without a doubt, the most popular supplements. They promise practicality, bringing together several vitamins and minerals in a single capsule. But are they really safe for your health? Although many believe that these supplements are harmless, excessive consumption can have serious consequences, especially for the liver. This organ is responsible for metabolizing most of the substances ingested, and an excess of fat-soluble vitamins, such as A, D, E, and K, can overload it. These vitamins accumulate in the liver and, in high doses, can lead to a condition known as hepatotoxicity, causing inflammation and permanent damage. Additionally, minerals in multivitamins, such as iron and zinc, can also be problematic. Excess iron can lead to a condition called hemochromatosis, which affects the liver, heart, and other organs. Zinc, in high doses, can interfere with the absorption of other important minerals and harm the body's balance. Another problem is that many people use these supplements without considering their existing diet. If you already consume a balanced diet, additional use of multivitamins may result in excessive nutrient levels. And the body, instead of taking advantage of this excess, needs to process and eliminate it, which requires extra work from the kidneys and liver. Multivitamins do not replace a healthy diet. In fact, they should only be used in specific situations, such as in cases of disability diagnosed by a healthcare professional. Self-medication with these supplements is dangerous and can do more harm than good. Therefore, before you start taking any multivitamin or multimineral, consult a doctor. He will be able to assess your real needs and prevent you from falling into the trap of this silent bomb for the liver and other organs. 3. Cava, the medicinal plant that hides a lethal risk. Cava, or Cava, is a plant traditionally used in Pacific Islands as a natural medicine and part of cultural ceremonies. It has gained popularity in the modern world for its calming effects, being widely used to treat anxiety, stress, and insomnia. Despite being sold as a natural solution, this plant hides a danger that can be fatal. Scientific studies have shown that consuming Cava can cause serious liver damage. The problem lies in compounds called cavalactones, which in high doses or with prolonged use can lead to hepatotoxicity. Documented cases include everything from liver inflammation, such as hepatitis, to severe liver failure, which may require a liver transplant. The severity of the risks has led several countries, such as Germany, Canada, the United Kingdom, and Australia, to ban the consumption of Cava. Although the product is still found in markets in other countries, many experts recommend caution in its use, especially for those who already have a liver condition or use medications that affect the liver. The greatest danger lies in indiscriminate consumption and lack of medical supervision. Many people believe that because Cava is a plant, it is completely safe. However, supplements and products derived from Cava may contain unpredictable doses of the active substances, increasing the risk of toxicity. If you already consume Cava or are thinking about using it, it is essential to consult a healthcare professional. Only he can assess whether this supplement is suitable for you and monitor possible impacts on your health. As tempting as Cava's calming effects may seem, the risk of irreversible liver damage should not be underestimated. In many cases, there are safer alternatives for treating anxiety and stress without compromising your health. 4. Red yeast rice, an ally for cholesterol, but an enemy for the liver. Red yeast rice is widely used by people looking to reduce cholesterol levels. It is produced by fermenting rice with a type of yeast called A. purple monk. During this process, monacolin K is formed, a chemical compound similar to the active ingredient in lovastatin, a medication used to control cholesterol. Although red yeast rice is considered a natural supplement, its effects on the body are no different from those of a medicine. Like lovastatin, it can cause serious side effects, especially liver damage. The liver is responsible for metabolizing substances such as monacolin K. When this compound is ingested in high doses or without supervision, it can overload the organ, resulting in inflammation and even hepatotoxicity. Furthermore, as cholesterol is also synthesized in the liver, interfering with this process can lead to other liver problems. Another worrying factor is the lack of control over the concentration of monacolin K in red yeast rice supplements. Unlike medicines, supplements do not undergo the same level of regulation. This means that doses can vary significantly between products, increasing the risks of consuming excessive amounts. There are reports of consumers developing hepatitis or liver failure after prolonged use of red yeast rice. Furthermore, consuming this supplement in conjunction with other medications, especially those that affect the liver, can amplify the damage. If you have cholesterol problems, it is essential to seek medical advice before resorting to red yeast rice. A professional can help you find safe treatments and monitor your health appropriately. Although this supplement is popular because it is natural, it can be as dangerous as poorly administered medications. Taking care of your liver is essential, and conscious decisions can avoid serious complications. 5. Calcium, the essential mineral that can overload your kidneys. Calcium is essential for the health of bones, teeth, and various body functions such as blood clotting and muscle contraction. Many people, especially menopausal women, turn to calcium supplementation to prevent or treat osteoporosis. However, excessive or inappropriate use of this supplement can pose serious health risks, especially for the kidneys. When calcium is consumed in excess, the body may have difficulty processing it properly. Some excess calcium can accumulate in the blood, which puts a strain on the kidneys, which are responsible for filtering it and eliminating it in the urine. This extra effort can lead to the accumulation of crystals in the kidneys, which turn into kidney stones. Kidney stones, in addition to causing intense pain, can obstruct urinary flow and permanently damage kidney function. The situation becomes worse if excess calcium occurs without the presence of adequate levels of vitamin D, necessary for its absorption in the bones. Thus, the loose calcium in the body ends up increasing the work of the kidneys even further. Furthermore, excessive calcium consumption can also harden the arteries, increasing the risk of cardiovascular disease. Studies suggest that indiscriminate supplementation may do more harm than good, especially in people who already have enough calcium in their diet. The best way to ensure the benefits of calcium without the risks is to prioritize foods rich in this mineral, such as dairy products, dark green vegetables, and seeds. If supplementation is necessary, it should only be done under medical supervision and in doses adjusted to your needs. Protecting your kidneys means avoiding overloading them with excess calcium. Taking supplements without need or supervision can turn this essential mineral into a villain for your health. 6. John's wort, the natural remedy that can interact dangerously with medications. St. John's wort, or Hypericum perforated, is widely known for its purported benefits in treating anxiety, mild depression, and sleep disorders. Because it is a natural remedy, many people believe that its use is completely safe. However, this plant can be extremely dangerous due to the drug interactions it causes. The active compounds in St. John's wort affect liver enzymes responsible for metabolizing several medications. When consumed, it can accelerate or inhibit the metabolization of medicines, altering their concentrations in the body. This means medications can become less effective or, in some cases, toxic. For example, St. John's wort can reduce the effectiveness of oral contraceptives, anticoagulants, HIV treatment medications, chemotherapy drugs, and antidepressants. Additionally, when interacting with other antidepressants, it may increase the risk of a serious condition called serotonin syndrome, which can cause mental confusion, seizures, and even coma. For the kidneys, this plant can be even more dangerous. When there is an increase in medication metabolism due to the use of St. John's wort, the kidneys need to work harder to filter and eliminate waste substances. This additional effort can compromise kidney function, especially in people who already have kidney problems or are taking medications that put stress on these organs. As harmless as it may seem, St. John's wort should be used with extreme caution and always with medical advice. A healthcare professional can evaluate possible drug interactions and monitor their effects on the body. Don't be fooled by the idea that everything natural is safe. Self-medication with this plant can have serious consequences, putting your health at risk. 7. Green tea extract, the supplement that promises but can destroy your liver. Green tea is widely known for its health benefits. When consumed in infusion form, it can help reduce fluid retention, weight loss, and protect against free radicals, thanks to the antioxidants present in the plant. Camellia sinensis. However, in its concentrated form as an extract, green tea can be a threat to the liver. The problem lies in the high concentrations of epigallocatechin gallate, EGCG, the main antioxidant in green tea. Although it is a beneficial compound in small doses, when consumed in excess, it can cause serious liver damage. Studies show that EGCG in high concentrations can lead to the formation of free radicals instead of fighting them, resulting in damage to the mitochondria of liver cells. Reports of hepatotoxicity caused by green tea extract supplements are becoming increasingly frequent. Recorded cases include liver inflammation, liver failure, and in extreme situations, the need for liver transplantation. In a study conducted in the United States, more than 80 cases of serious liver damage were associated with the consumption of these supplements. One of the reasons for these side effects is the difficulty in controlling the dosage of EGCG in the products. While a cup of green tea contains safe doses of this antioxidant, supplements can offer much higher concentrations without clear regulation. If you want to enjoy the benefits of green tea, the safest way is to consume it as an infusion, limiting yourself to a maximum of 4 cups per day. The use of extracts or supplements should be avoided unless there is a clear medical indication and constant monitoring. Even though green tea extract is sold as a weight loss and health solution, the risks to the liver are alarming. Prioritize your health and choose safe alternatives to achieve your goals. 8. Protein supplements, the excess that can become a weight on your organs. Protein supplements, such as whey protein, are popular among athletes and people looking to gain muscle or lose weight. Although useful for meeting high protein demands, excessive consumption can harm the liver and kidneys. The liver metabolizes proteins, transforming them into amino acids, but excess overloads the organ, leading to hepatic steatosis, fatty liver. Furthermore, excess proteins generate nitrogenous waste, such as urea, which overloads the kidneys, increasing the risk of kidney stones and, in severe cases, kidney failure. Lack of hydration worsens the problem, making it difficult to eliminate waste. The myth that more protein is better is dangerous, as the body has an absorption limit. Consulting a nutritionist is essential to calculate your protein needs and avoid health risks. Supplements are helpful, but too much can be harmful. 9. Garcinia Cambodia, the weight loss miracle that can compromise your health. Garcinia Cambodia, originally from Asia and Africa, gained fame as a weight loss supplement due to hydroxycitric acid, HCA, which promises to inhibit the conversion of carbohydrates into fats and reduce appetite. However, its frequent consumption can cause serious damage to the liver. Studies associate prolonged use with hepatotoxicity, with symptoms such as inflammation, abdominal discomfort, and in severe cases, liver failure. High doses of HCA cause oxidative stress in the liver, leading to liver inflammation and fibrosis. Additionally, many supplements contain chemical additives that intensify the risks. The lack of regulation exacerbates the problem, with variations in HCA concentration and inaccurate information on labels. Before using Garcinia Cambodia, it is essential to consult a doctor or nutritionist for safe alternatives. The weight loss miracle can be costly to your liver health. Make informed choices and prioritize your health. Artificial dyes, the danger contained in pills. Artificial colors are widely used in supplements to make them visually appealing, creating a false sense of quality. Derived from petroleum and synthetic materials, dyes such as yellow number 5 and 6, red number 40, and blue number 1 have been linked to allergies, behavioral changes in children, and in severe cases, liver toxicity. The liver, responsible for metabolizing these substances, can be overloaded, leading to inflammation and functional impairment. Additionally, chemical residues can accumulate in the body, causing long-term effects. Many of these dyes are banned in several countries due to risks, but they are still present in supplements from regions with more relaxed regulations. Consumers often do not notice its presence due to technical names on labels. To avoid these risks, choose supplements free of artificial colors and prioritize natural products, protecting your health and reducing the impact on the liver. Hydrogenated oils, the hidden fats that sabotage your health. Hydrogenated oils, or trans fats, are used in supplements with fat-soluble vitamins, A, E, K, to dissolve and stabilize them, but they pose serious health risks. These fats contribute to the formation of plaque in the arteries, increasing the risk of atherosclerosis, cardiovascular disease, and stroke. Furthermore, they oxidize easily, generating toxins that overload the liver, leading to inflammation and hepatic steatosis. Trans fats also promote weight gain, obesity, and cholesterol imbalances, raising LDL, bad cholesterol, and reducing HDL, good cholesterol. Many of these oils are derived from transgenic sources, such as soybeans, whose long-term effects are not yet fully known. To avoid these risks, choose supplements that use natural oils or safe sources of vitamins. Checking the ingredient list is essential to protect the health of your liver, heart, and kidneys. Lead, mercury, and PCBs, the toxic side of supplements. Omega-3 supplements and fish oils are promoted for their cardiovascular and brain health benefits, but they may contain hidden risks such as heavy metals, lead and mercury, and toxic compounds, PCBs. These contaminants come from larger fish like tuna and salmon, which accumulate toxins due to pollution. Without adequate purification, these elements pass into supplements. Prolonged exposure to lead and mercury can cause damage to the nervous system, liver, and kidneys, leading to inflammation, functional changes, and kidney failure in severe cases. PCBs, substances banned in many countries, are linked to hormonal disorders, cancer, and immune problems. To avoid these dangers, choose trusted brands that carry out rigorous purification and have certifications against contaminants. Thus, omega-3 supplements can be safe allies for health, without the risk of invisible toxins that compromise quality of life. Magnesium silicate, a silent enemy in ingredients. Magnesium silicate, known as talc, is used in supplements as an anti-caking agent, preventing ingredients from sticking. However, it can present serious health risks, due to the possible presence of asbestos, a carcinogen associated with talc mining. Asbestos, even in small amounts, can cause cancer, including mesothelioma and lung cancer, with the risk of contamination varying depending on the purity of the talc and local regulations. Furthermore, regular consumption can accumulate residues in the body, causing inflammation and kidney problems. Legal cases against large companies confirm that asbestos contamination is not just theoretical. To avoid harm, check supplement ingredients and choose transparent, quality brands, avoiding products that contain magnesium silicate. This silent enemy demands attention and informed choices to protect your health. 5 more essential tips for choosing safe supplements. Choosing supplements may seem simple, but the traps hidden on the labels require extra attention. Following some basic guidelines can make all the difference in avoiding risks and protecting your health. Below, check out 5 essential tips that you need to know before investing in any product. 1. How to identify quality supplements. The first tip is to always check the origin of the supplement. Give preference to well-known brands that have a good reputation in the market. These companies generally follow more rigorous quality standards and have greater transparency in manufacturing processes. Read the label carefully. Quality supplements detail the composition, inform the exact dosages of the ingredients, and do not hide important information in small print. If the label seems confusing or incomplete, be suspicious. Additionally, look for information about the manufacturing company. Make sure it follows good manufacturing practices and has certifications from recognized bodies, such as ANVISA or other international regulatory authorities. 2. Which certifications are essential in supplements? Certifications are a guarantee that the product has undergone rigorous testing to evaluate its safety and effectiveness. Look for seals that attest to the absence of contaminants such as heavy metals and pesticides, especially in herbal supplements or fish oils. Seals such as BPA-free, GMO-free, and organic certified are also indicative of greater safety. In the case of supplements of animal origin, such as collagen or omega-3, look for guarantees of sustainability and purity. These certifications not only ensure the quality of the supplement, but also help protect the consumer against fraudulent practices. 3. What to avoid in ingredients lists. Be aware of ingredients that may pose health risks, such as artificial colors, chemical sweeteners, hydrogenated oils, and unnecessary preservatives. Ingredients such as magnesium silicate, titanium dioxide, and polyethylene glycol should be avoided. Remember that less is more. Supplements with short ingredient lists are generally safer and more effective. If you encounter terms that you cannot identify or understand, consider seeking information or avoiding the product. 4. How to consult a healthcare professional for supplementation. Before including any supplement in your routine, consult a doctor or nutritionist. These professionals will be able to assess your real needs and recommend the most suitable products for your case. Nutritional deficiencies can often be corrected with dietary adjustments, avoiding the need for supplementation. When the use of supplements is recommended, monitoring by a professional ensures that the doses and combinations will be safe. Avoid relying solely on recommendations from friends or digital influencers. What works for one person may be harmful for another, especially if there are pre-existing health conditions. 5. The importance of laboratory tests before supplementation. Before starting to take any supplement, it is crucial to carry out laboratory tests. These tests identify possible nutritional deficiencies and help determine the exact amounts you need. Tests are also useful for monitoring the health of your organs, such as your liver and kidneys, while taking supplements. This is especially important for people who take multiple supplements or use these products for a long time. Additionally, regular testing helps avoid excesses, which can be as harmful as deficiencies. With concrete data in hand, it is possible to personalize supplementation and reduce health risks. Taking care of your health goes far beyond choosing supplements. It's about understanding that every decision you make can positively or negatively impact your well-being. Although these products are widely promoted as quick and effective solutions, it is essential to remember that not everything that appears beneficial actually is. Your body is unique and deserves individual attention. Avoiding the indiscriminate use of supplements and seeking professional guidance are fundamental steps to protect your vital organs, such as the liver and kidneys, and ensure a healthy life. Every choice you make today is an investment in your quality of life in the future. Therefore, inform yourself, evaluate your real needs, and make informed decisions. You have the power to take care of your body in an intelligent and responsible way. Protect your health. It is the most valuable asset you have.